Think about the incredible, violent force of a high-speed car crash. In a split second, all that energy slams into the human body. And one of the most vulnerable parts? The aorta, the single largest artery you have. Today, we're diving into the amazing story of how medicine has completely changed the game in the fight to save people with this kind of devastating injury. Let's get right into it. So when we talk about these really severe chest injuries, you know what we're usually talking about? Something we all see every day: car crashes. They're responsible for more than 70% of these blunt thoracic injuries. It really puts this whole medical drama into a sobering, real-world context. And here's the brutal, honest truth of it. For a huge number of people, something like 80 to 85%, with a major aortic tear, the injury is fatal, right there, almost instantly. For the very few who manage to survive that initial impact, the clock is ticking, and it is ticking loud. So what exactly is this injury we're talking about? Let's break down the mechanics of what's actually happening deep inside the chest during a collision. The medical term is thoracic vascular trauma. It's a bit of a mouthful, but it basically means damage to the big blood vessels in your chest. We're zeroing in on the aorta, that massive superhighway for blood coming right out of your heart. The sheer force from a crash can be so violent it can literally tear that pipeline apart. Let's get into the physics here for a second, because it's actually pretty interesting. Your aorta isn't just floating in there. Parts of it are tacked down, while other parts can move. So during a sudden, violent stop, the mobile parts of the aorta swing forward, but the fixed parts, well, they can't. All that shearing force concentrates on one spot, the aortic isthmus, and that's almost always where the tear happens. Okay, so you have a patient. They're bleeding internally from the body's biggest artery, and as a doctor, you're facing a huge problem. You can't fix what you can't see. And for decades, actually seeing this injury was incredibly, incredibly difficult. Answering that one question has basically driven a revolution in emergency medicine. Because finding that tear, and finding it fast, is without a doubt the first and most critical step to saving a life. I mean, just look at this slide. It shows the leap perfectly. For years, all doctors had was a standard chest X-ray. Its sensitivity for this injury, a shocking 33%. That's like trying to find a tiny crack in a dam with a blurry photograph. But today, we have this CTA scan. It gives doctors this incredibly precise 3D map of the arteries, and it's almost 100% accurate. This isn't just a small improvement, we're talking about a total game changer. It's night and day. And hey, don't just take my word for it. This isn't just some new fad. The medical community is unanimous. The CTA scan is now, without question, the gold standard. It lets doctors see exactly where the tear is and just how bad it is, which is absolutely essential for what has to happen next. All right, so the injury's been found. What now? Well, the next critical step is to figure out the severity. See, not all tears are created equal, and the type of tear is going to dictate the entire treatment plan. Doctors classify these injuries into 4 grades. Grade 1 is a pretty small tear, just on the inner lining. Grade 2 is more like a bruise inside the wall of the artery. But grade 3, this is where things get really, really dangerous. It's called a pseudoaneurysm. That means the tear has gone through the inner layers, and only the thinnest, outermost layer of the aorta is holding back a catastrophic bleed. And grade 4, well, that's a full-on rupture. Now, what's so wild is looking at the patients who actually survive long enough to get to the hospital. A full 50%, half of them, arrive with a grade 3 injury. They are, and this is not an exaggeration, one thin layer of tissue away from bleeding to death. It just highlights the incredible urgency these trauma teams are up against. So this brings us to the real climax of the story. You've got an accurate diagnosis, you know exactly how bad the injury is, and now we get to the most dramatic innovation of all: how doctors actually fix it. You know, for the longest time, the cure was almost as dangerous as the disease. Trying to repair the aorta is one of the most difficult, high-stakes operations a surgeon can do. It's just loaded with risk. This slide really lays out the 2 different worlds. On one side, you have traditional open surgery. We're talking a huge incision, cracking the chest open, clamping the body's main artery. It's a massive, high-trauma procedure. But on the other side, you have this modern marvel called TEVAR. Surgeons make a tiny little cut in the groin, thread a device called a stent graft all the way up into the aorta, and then deploy it. It essentially relines the torn artery from the inside. It's brilliant. And this shift has been so profound, so effective, that the official guidelines from the Society for Vascular Surgery now say this minimally invasive TEVAR procedure should be chosen over the old open repair. This is the new standard, period. And if you want to know why, well, here it is. Just look at these numbers. The mortality rate directly related to the aorta for open repair was over 13%. For TEVAR, it's just 2.5%. That is a staggering, life-altering difference. This one chart represents thousands of people who are alive today because of this innovation. But wait, there's more. The benefits go way beyond just survival. Patients who get TEVAR have a lower risk of paralysis, they need fewer blood transfusions, they have fewer complications like pneumonia, and they get to go home to their families sooner. It is a win across the board. So this revolution in how we diagnose and repair these injuries has fundamentally changed the odds for trauma patients. But as with anything in medicine, the story of innovation is never really over. The overall in-hospital mortality for patients who get TEVAR is now down to 8.6%. I mean, that is an incredible number, especially when you think about how deadly these injuries used to be. But it also shows us there are still challenges to overcome. One of the biggest challenges is that trauma patients often have multiple severe injuries at once. So, for example, a patient might have a traumatic brain injury and an aortic tear. The brain injury needs high blood pressure to get enough oxygen, but the aortic tear needs low blood pressure to keep it from rupturing. So what do? Doctors have to make these incredibly difficult minute-by-minute decisions to balance these completely opposite needs. And another thing to remember is that this TEVAR technology is still relatively new. And since trauma patients are often very young, we're still studying how durable these stent grafts are over the long haul. The big question is, will they last for 50 or 60 years? The research on that is still ongoing. So we've gone from a blurry X-ray to a crystal clear 3D scan, from a massive chest-cracking operation to a minimally invasive repair through the groin. The way we treat this trauma has been totally transformed. But it leaves us with one final fascinating question for the future. As our technology gets smarter and our tools get more powerful, how do we make sure we're always tailoring them to the unique, chaotic, and incredibly high-stakes reality of every single person who comes through those emergency room doors?